I think there are, I suppose, very clear differences in the role. Governors are here to represent their members, they're accountable to the members of the trust and to the public, and they also hold the non-execs to account. They are involved in appointing and, if necessary, removing the chair of the trust and the non-executives. They are in fact involved in terms of not making the decision but approving the appointment of the chief executive, and in receiving the annual report and the accounts, and obviously now very much more involved in what we would call a significant investment. And in relation to the non-execs, we're part of a unitary board, so that means we're individually and collectively responsible and accountable for what we do. And that's around governance, that's around assurance, that's looking at the strategic development of the organisation. But again, it's still done in a partnership with the governors, that you're working with them. But I suppose at the end of the day, it's the accountability that sits with the board and therefore with the executives and the non-executives. So I think there is a very clear difference in relation to to our accountabilities and our responsibilities. So hopefully that will help governors understand they have a very important strategic role to play, but it's a different one to non-execs. And I suppose in terms of all our experiences, sometimes we just need that clarity and understanding. I was, if you like, a director of children's services before I retired. And going from an operational role to a more strategic role as a non-exec, you have to learn the difference. And I'm not here to run an element of the trust. I'm here to challenge, to support, and to seek assurance in relation to the way that we're operating as a trust, that we are delivering those high quality standards to our patients and our service users. I suppose one of the very clear examples of working together to improve is to actually share what does it mean to hold non-executives to account. That was a working group that came together that worked through many of the difficult issues and I suppose perceptions of what it might mean to come up with a framework where everybody feels comfortable. And I suppose that's organisational, that's process. But there are lots of examples where our governors are involved with our service users and patients in many of our subcommittees, such as the service users and carers subcommittee. Some of our governors are there as carers. So they are working together in relation to delivering the trust's priorities. We also had a governor sitting alongside us looking at the disposal of one of our sites. When we were disposing of an old hospital site, the governor sat alongside, witnessed the meetings, contributed to those discussions about how best to do that in the best interest of the trust, but also in terms of our neighbours and the environment. So some very important examples of where governors are involved in the way that we work. We've got a major capital development happening across our sites to improve our facilities, and we've had governors very much involved in looking at our facilities and our estate, and actually contributing from their perspective about where we need to focus and where we need to prioritise. Again, to me, it's a partnership, and it's a partnership of sharing, understanding the different roles and responsibilities we have, but actually saying this is how we can best work together. In relation to feeding in views or thoughts about the roles of non-executive directors, I think we feel very fortunate for our trust that the non-execs come from a wide range of different backgrounds, and I think that's very important. I think it adds value, it adds a different perspective. It's not easy for people who are working full-time to be a non-exec, but we do have two non-execs who are still working, so therefore they're not a retirement age, and they work for the private sector, and that brings a different perspective to our discussions at board and in terms of their thoughts and support to build our strategic direction. We also have somebody who's a retired GP, we have people from local authorities, and in a way we each bring something different to our role as a non-exec. And I think that is important. It could be very easy to say, because of the amount of time that we're expected to contribute to the work of the Trust, that it might just be people who are retired. But I think it's very important to actually support younger people also coming in onto the board as non-execs. And the other aspect for me as a non-exec is that through our visits to our services, to our work through Mental Health Act appeals, that we actually can show that we're living the values of the Trust when we meet our staff, when we meet our patients and service users. And we can also check that our staff are living those values. And what's so important is if we see things, if we are uncomfortable, if there's something we've got a concern, that we can bring that back to the executives and know that it's dealt with, know that we're listened to, and that's part of everybody living the values of the Trust.